This PowerPoint will cover the topic of ADHD. Material is presented by Claire Madera
and Rosie Scannell for PSY 434. In this presentation, we will talk about some of the research that is currently being done to better help us understand the genetic influences of ADHD. Specifically, we will look at twin studies, family studies, and molecular studies. In addition, we will look at the relationship that ADHD has through genetic and environmental interactions and correlations.
ADHD stands for Attention Deficit Hyperactivity Disorder. Often, ADHD is seen in children who have a hard time controlling their concentration to the task at hand. Untreated, ADHD can interrupt the daily functioning and development of a child, which leads to troubles later in life. The Center for Disease Control estimates around 11% of children have ADHD, but the disorder is often underreported, so this percentage is likely higher. DSM-5 cites this behavior as shown in children under the age of 12, though ADHD lasts long past childhood. Some phenotypic traits of those with ADHD can be seen through the inability to complete a given task, overly impulsive actions, lack of emotional control, fidgeting, and disorganization. Though it is important to note that ADHD presents itself differently, so the severity of symptoms varies greatly from person to person.
To better understand the genetic and environmental influences that ADHD has, we've looked at various types of research currently being produced in the field of behavioral genetics. Specifically, we looked at the heritability of comorbidity in twin studies, prenatal care in family studies, and the DRD4 gene in molecular studies. Twin studies are the most common form of ADHD research, as ADHD research is shown to be very heritable. This research method, as stated in earlier classes, allows us to look at how much of the role genetics plays versus how much of a role environmental factors play. Twin studies have been incredibly crucial for identifying comorbidities that occur with ADHD. Occurring in conjunction with ADHD, these comorbidities include conduct disorder, learning disabilities, and sleep disorder. Within the realm of learning disabilities, reading disabilities especially have a high comorbidity rate with ADHD, which can be especially troubling in school settings. Research using twins have produced a genetic heritability correlation of 0.42. Twin studies have been vital for demonstrating the genetic overlap between the two disorders, showing that there is significant genetic overlap for inattention and reading, but not in hyperactivity. Researchers have also suggested that ADHD can be a valid predictor and risk factor for reading disabilities. While a common gene for ADHD and reading disabilities have not been confirmed through twin studies, many researchers in the field believe the comorbidities are due to common genes demonstrating a pleiotropic effect. As individuals with ADHD age, the comorbidities begin to differ to include more psychological disorders, such as anxiety and depression. These co-occurring conditions play off of one another.
Family studies have also been a crucial form of research for ADHD, as they allow for genes and the environment to be teased apart, as we have learned in previous classes. By doing these types of studies, especially through adoption, it can be easier to pinpoint specific factors that are influencing the occurrence of ADHD. Family studies confirm much of what has been found in twin studies, that ADHD is highly heritable. This can be seen when looking at adoption specifically, as the likelihood a child has ADHD increases if their biological parent also has the disorder. With family studies, we also see an increase in ADHD in adopted children, 7 out of 100 for non-adoptive compared to 15 out of 100 in adoptive. Researchers hypothesize that this is due to prenatal issues such as low birth weight and maternal smoking. These prenatal issues also correspond with GE correlations of low socioeconomic status, as children who are adopted are less likely to have received prenatal care.
Molecular research, though not as prominent as other research methods, have recently become more important form of ADHD research as researchers are eager to find the location of ADHD on the genome. One interesting finding of molecular research on ADHD has been seen in the D4 receptor gene, or the DRD4. DRD4 is a protein-coding gene often found in dopamine pathways such as the mesolimbic system. This gene has been associated with many of the phenotypic responses observed in those with ADHD, such as inattention and hyperactivity. One reason for that could be that the DRD4 is activated not only by dopamine, but by norepinephrine as well. It has been shown that ADHD can be caused by a lack of norepinephrine in the brain, a neurotransmitter that heightens our attention and response. Also, this gene is a part of the receptor family that is located in the prefrontal cortex, amygdala, and midbrain, areas that directly influence how our brain handles organization, restlessness, and hyperactivity. While molecular research faces difficulties in replication, studies focusing on DRD4 have brought more consistent results than most.
ADHD has many interesting relationships, which show how this disorder is presented and treated. Looking at both relationships of correlation and interactions caused through the interplay of genes and the environment, we see how they work together. Research on genetic and environmental correlations present in ADHD focus mainly on socioeconomic status. Research shows that financial difficulty, insecure housing, unmarried family type, and low maternal age at birth all increase the risk of ADHD. A literary analysis found that 35 of 42 articles reported a significant association between a measure of socioeconomic disadvantage and increased risk of ADHD at the 5% level, indicating that kids in low SES households are more likely to have ADHD than peers in higher SES households. Although poverty does not cause ADHD, it exacerbates the tendencies seen in children. According to the Fragile Families and Child Wellbeing Study, a 15-year longitudinal study focusing on the correlation between family income at birth over the course of multiple generations and ADHD, young children's risk of ADHD was positively correlated with family income and subsequent socioeconomic status. Research suggests that prenatal mental status and accessibility to prenatal care are two examples of factors that are influenced by SES, which have been shown to correlate with higher rates of ADHD in twin and family studies.
Genetic and environmental interactions are also an interesting relationship to look at, as these interactions greatly impact what the disorder looks like. Parents and teachers play a large role in helping a child to manage ADHD by giving them access to the tools necessary to continue to participate in their daily lives. Their involvement is influential from the very beginning, as recognizing ADHD can be very difficult, as the traits are often dismissed as common childhood actions. Many cases of ADHD are not reported, which then greatly harm the success of the children in their future endeavors, especially in females. Boys are more likely to have these tendencies associated with acting like a boy, while girls are scolded for these unladylike actions. As a result, boys are more likely to be tested and treated for ADHD, while girls will likely go underdiagnosed. Medication has also been shown to be the most effective treatment plan for those with ADHD, though it is best received when paired with other aids such as IEPs, individualized education plans, which is where a parent-teacher relationship is vital for making sure kids get the most successful care for their needs. In a survey conducted by the National Survey of Children's Health, the NSCH, results showed that even when a child was diagnosed with ADHD by a physician, almost 2/3 were taking medication and slightly less than half had received behavioral treatment for ADHD in the past year. Nearly 1/4 had received neither treatment. When support is evident and accessible to the child, there is a higher probability that treatment care will be utilized for the child's full benefit. This recognizes the importance of outside factors have on ADHD as presented.
"23% of children with ADHD are not receiving medication or behavioral treatments." The amount of children with ADHD who are not receiving medication or other treatment for ADHD should be alarming. As research shows, these therapy measures are effective in helping children thrive despite their condition. The comorbidities that exist alongside ADHD can greatly impact an individual's life if left untreated in childhood, which is why it is an important disorder to be researched for greater understanding.
To help finish our presentation, we would like to present you a short video summarizing some of the things we have discussed on ADHD.
Imagine a Ferrari, but with the brakes of a bicycle. That's how psychiatrist Edward Halloway describes the brain of a person with ADHD, or Attention Deficit Hyperactivity Disorder. Most people experience symptoms like fidgeting, forgetfulness, or losing focus every once in a while. But for people with ADHD, these symptoms are constantly present. Whether you're at the office, the home, or classroom, there's no off switch. That's because people with ADHD experience the world differently. One example is time. Most people perceive time as linear. However, the ADHD brain experiences time as a scattered, interconnected collection of events rather than a sequence. The cause of this is neurological. ADHD brains look and function differently from normal brains. MRI scans have shown that ADHD brains have a smaller prefrontal cortex, which is often referred to as the brain's control center. For normal brains, concentrating causes activity to increase in the prefrontal cortex. But for ADHD brains, the more they try to concentrate, the less activity there is. ADHD brains also have lower levels of dopamine. Dopamine helps control the brain's reward and pleasure centers and regulates movement and emotional responses. Low dopamine makes it extremely difficult for ADHD brains to stay motivated. They're naturally compelled to seek stimulation, causing focus to drift easily. Much like a Ferrari with bicycle brakes, the ADHD brain is powerful, but difficult to control. With proper care and maintenance, both can be managed.
We'd like to end with the following summary. ADHD is a very complex neurological disorder in that it has been shown consistently across twin and family studies to be incredibly heritable. But symptoms can also be manipulated or controlled through environmental influences. Such is the case in molecular research and prenatal studies that suggest ADHD is very much dependent on prenatal development of dopaminergic pathways. Many factors make ADHD very difficult to identify and treat, such as strong comorbidities of reading disabilities and conduct disorder, often leading to complicated sets of symptoms that overlap. Not to mention the social barriers to identifying ADHD, such as the gene-environment correlation of socioeconomic status, which can lead lower-income children to be at a higher risk. Finally, there are several gene-environment interactions that are currently being studied, but one of the most prominent is parent-teacher interventions and pharmacology. Children who are currently on medication for ADHD and undergo behavioral therapy show far greater success in school settings than children only doing one or the other. As we have demonstrated, ADHD is a common yet complex neurological disorder that has just recently begun to have its time properly researched. In the past, ADHD was often shrugged off as nothing but a lack of discipline in a child's routine or an intentionally unruly child. We now know this is simply not the case. While much has been discovered on the biological and genetic components of this disorder, much research is still needed to ensure the success for children and adults living with ADHD. This concludes our presentation on ADHD. Thank you so much for listening.